You know, Leo, I was looking the other day at an article that said the U.S. spends more money than any other country on health care in the world, yet our life expectancy is shorter, obesity is higher, the rate of maternal and infant death is higher, and so we're not very healthy, but we're spending all this money. I just wanted to put it in perspective and get a little thought on this, if I could. Seth Denson is president and co-founder of GDP Advisors. They give advice on healthcare providers and the entire healthcare system. I got a pretty good handle on this. Wanted to get his opinion. Hey, Seth, glad you joined us on the Common Sense Show today.
Hey, good morning, Jim. Thanks for having me on.
Yeah. Seth, give us your perspective. You watch this very closely in terms of the work that you do, and it seems like in so many areas, why are we getting less healthy, and yet we're paying so much more for health care compared to other high-income countries like Canada, Germany, Japan, Sweden, France, Denmark? They all are having performance outcomes that are about the same as ours, yet they pay so much less. What's the factors that makes health care so darn expensive for people in America today?
Yeah, I think to get to the root of this, you really have to break it into really two areas. I mean, you've got to take those two things you just stated and almost separate them. One, why is healthcare so expensive in the United States? And two, why is it less expensive and equally as effective, we'll say, in other countries? Because I think those are two separated issues, unfortunately. The reason why other countries are, we'll say, having the same outcomes but lower costs, quite frankly and simply, it's because of government intervention in controlling the cost overall, which we don't really have here in the United States. And so other countries, France, England, Canada, Germany, Australia, effectively the ones that were done in this most recent study and reviewed, all have certain government controls within them to regulate things like the cost of prescription drugs, the actual cost of delivering health care within the systems. Some even have government-controlled single-payer systems. So that does keep the cost down overall, but really what we're seeing are the same outcomes. Now, here in the United States, there are multiple drivers as to the overall cost components, and we could spend literally hours talking through all of them. But the key ones are the fact that here in the United States, there is a significant lack of transparency in the healthcare delivery system. And part of that is because the financing system, which is health insurance, is extremely complex in that, let's just take, your Blue Crosses or your Aetnas or United Healthcares, which, their network systems actually have systems within themselves. So if I'm a United Healthcare or an Aetna or a Blue Cross, I don't just have a singular network that a hospital system has negotiations with. I have multiple layers within that network that actually mean that hospitals are spending more on administrating the accounts receivable department than they are in actually treating you or I when we go into those hospitals in the first place. And so
I hear that. Yes, I hear that a lot from providers, from the doctors and the administrators saying, "Look, we're just so bogged down in paperwork, and then we get rejections, and we know the person does have some kind of insurance. Maybe it's not all I thought, but the paperwork involved is just enormous in this country." And you say you don't see that as much in other countries?
No, you don't see it as much because it's much more standardized. So, for example, let's just take an MRI, for example. I can go and get an MRI at one of a dozen places within 5 miles of my house, but the standardized pricing structure before network discounts are given is different at each one of those locations. So, for example, United Healthcare might have one negotiated standardized price with one of these providers and another standardized negotiated price with another. And so, as hospitals and providers are trying to navigate these complex contracts that they have based on the various procedures that they might provide, it takes a lot of man hours and time. A recent study, interestingly enough, showed that Duke University Hospital has 900 beds. They have over 1,100 administrative clerks in their accounts receivables department and billables department just to administer the health plans. So when you have more people having to manage the bills than you do beds in a hospital, I think that is a driver of part of the problem.
Well, Seth, let me ask you this. I mean, the government in our country does control a significant amount of health care. When you look at Medicare and Medicaid, if you add Medicare and Medicaid together, I think isn't that about 60% of the people who are getting health care? Why hasn't the government shown more focus and demand in setting these standards and try to bring about uniformity?
Yeah, so you're right, and when you add up Medicare and Medicaid, you get the majority of numbers of people that are having health care delivered to them. To just be overly simple, because I think that I like to try to keep things common sense and simple, the government hasn't gotten involved in this because of politicians. The government has the most buying power of any entity in the United States when it comes to health care, and the way in which they curate health care is so convoluted and backwards that you and I, from a common sense perspective, would look at it and go, what? For example, let's talk about how in the Medicare Part D system they procure drugs, right? It's not that the government, which buys more drugs than anyone else, goes in and negotiates the cost of drugs with the delivery system. Instead, what it does is it makes this process by which these manufacturers have to sell their drugs at a 25% discount of their lowest average wholesale price. Okay? So the government did this in the Affordable Care Act, too, when they were trying to bring down the cost of health insurance and said that health insurers had to manage to what we call an 85% managed loss ratio. In other words, 85 cents of every dollar that they collected, they had to pay in claims. Well, if I am a CFO or even a CEO of a publicly traded insurance company, what the government has just told me isn't that I have to reduce my costs so I spend more dollars on claims. All that it's told me is I got to make sure that to hit my margins, the amount that I'm taking in is at least 15% more than what I need, right? So the same thing happens in prescription drugs. These manufacturers aren't necessarily saying, okay, we're going to give the government a better deal of 25%. They're just inflating the cost to make sure they're making their margin on the government's dime, on yours and my dime as taxpayers. And so it's extremely inefficient, whereas anything else that you would buy, let's use the Sam's Club or Costco methodology. If I'm buying in bulk, I want a better deal. Let's negotiate that deal. And unfortunately, It's not what the government is doing with it when it related to prescription drugs.
So right after the show, you get this call from the White House, and Donald Trump comes on and says, Seth, I listen to you on the Jim Brown, Leo Honeycutt show. I listen every week. That's my favorite show. It was
huge.
It's huge. And I heard what you said. What's your recommendation? What do we do to keep these insurance companies from inflating the amount they get? Do you bid it out? Do you set certain parameters? What would you suggest to the president that we do?
Yeah, so first of all, he's probably going to tweet me, not call me, right? But let's assume he did reach out. I think there are really a number of solutions that we could do from a governmental standpoint, and some of them you could turn a stomach a little bit depending on your political leanings, because unfortunately, with healthcare as big as it is, I think the government does have to step in from some side of regulation, not necessarily regulating prices or anything like that, but just controlling the playing field. So there needs to be a standard set of pricing for goods and services in the healthcare markets, right? That is step one. Step two is transparency. I actually think transparency is the key, right? Hospitals, providers, pharmaceutical companies have to be more transparent in how they manage things. The FDA needs to remove some of the...
Can you hang on? Hang on. We got to take a break. I want you to be able to finish your thought on this. If you can hang on just a minute or two for me. I want to tell our listeners we're talking to Seth Stenson, president of GDP Advisors. His website is gdpadvisors.com. We'll come back and continue this fascinating area of how we get healthcare costs down. Common Sense Radio will be right back.
Welcome back to Jim Brown's Common Sense. Now, here's your host and professor of Thinkology, Jim Brown.
Hey, healthcare is what we're talking about right now. The outrageous cost. Everybody complains about it. Seth Denson's our guest. He's president and co-founder of CDP Advisors. Seth, I interrupt you there before. You were talking about what we should be doing to lower the cost. Go ahead and pick up on that thought again, if you will.
Yeah, thanks, Jim. I think that sadly, while in the United States, healthcare is a sixth of the economy and growing, I really do believe firmly that it can be solved in a somewhat, I don't want to say overly simplistic manner, but just using common sense, right? So we mentioned the standard set of pricing for goods and services. That the problem is the average consumer, when I go buy anything else, a television, a car, or a T-shirt, right? I kind of got an idea of what things are going to cost before I go and I procure them, right? But healthcare is not. Healthcare is actually one of those areas where I go in, and matter of fact, I have things done to me before I ever even know what the tab's going to look like at the end. And so there needs to be a standard set of pricing for goods and services and a national registry of that throughout the country. I mentioned transparency. The healthcare system is extremely non-transparent, whether it be network issues or what I'm paying for what, where, and how. It needs to become more transparent. When it relates to prescription drugs, the FDA needs to allow drugs to get to market faster. It takes roughly 12 years and over $2 billion to bring a drug to market. Well, that really limits the ability for good quality drugs to get to market, and it means that when that drug finally does get to market, a pharmaceutical company has to collect an obscene amount of money just to try to make up their costs. So that's another key solution I think could be there. And then we have to slow down some of this consolidation. 85% of all drugs filled in the United States are filled by one of three distributors. CVS Caremark is one of them, Express Scripts, and then Optum Health. And these are middlemen that are buying drugs and then reselling them to the population. All three of these key PBMs, the largest that control 85% of the marketplace, are owned by insurance companies. So we're seeing this significant consolidation of the healthcare market. The return on investment is 8-to-1, according to a recent report, in the healthcare system for private equity money. So we're seeing a lot of movement into this space of this investment with high return, and that's because of these key areas and issues that I think can be solved. But transparency, boil it down, is the number one driver that could solve a big chunk of the healthcare issues here in the United States.
And Seth, is it campaign contributions, or what is the driving force as to why Congress has not reacted more? It seems like Congress just, all they want to do is abolish Obamacare. They use buzzwords. There's no real thinking in terms of the details that you expressed here now. I wonder why that is.
Yeah, sadly, I think that part of that is what you just mentioned, buzzwords, right? We're all worried more about the sound bites and the wins than we are the solutions themselves. And so, we put out a 10-point bullet plan this past summer when health care and the Affordable Care Act and repeal and replace was being debated as to what we felt were independent, nonpartisan solutions that could solve this thing. The problem was there were things in there that Democrats loved and things in there Democrats hated, and there were things in there Republicans loved and things in there that Republicans hated. And when you combine those two together, you get into a stalemate because nobody's willing to give. They just want to get. And I think that's the biggest driver. There is crony capitalism going on. There is a significant impact of lobbying going on. And the problem is when we're talking about other economic factors, that's one thing. This is health care. This is life and death for a lot of folks. And really we need to step back and say, all right, politics aside, this can be solved, and we need to do it. Now, that's a macro solution. It starts with a micro solution, and that's you and me being better consumers, better understanders, asking better questions, and moving differently in how we consume healthcare as well.
Hey, Seth, this is Leo Honeycutt. I agree with everything you just said, but, I mean, at the end of the day, how many people can actually get their doctor on the phone? I hear this all the time about how you ask your doctor before you do such and such. I can't even get my doctor on the phone for a 2 or 3 week away appointment. So it's not a whole lot of transparency with regard to that. But the other thing, too, is I heard this economist some years ago say that one thing you'll never see is a young whiz kid whippersnapper going into an insurance company company and saying, hey, I know how we can pay claims faster and streamline this whole operation, because insurance companies make a great deal of their money off the float by not giving out the money.
Yeah, you're absolutely right, and I'll tell you one thing. They pay us young whippersnappers a lot of money to keep our mouths shut and fall in line. You know, I for most of my career, I was a health insurance agent, and you know, they paid me handsomely to just kind of keep up with the status quo. When costs go up, they pay me more money. So I jokingly said at a seminar I was speaking at on drivers of healthcare that you know, health insurance was a drug, and they paid me to be the crack rock dealer. And sadly, that's the world we live in. But you know, a couple things about that, and specifically to the doctor question you mentioned, I get it. And we're seeing fewer doctors come out and wanting to get into general practice any longer. I mean, America is actually on the cusp of a understaffing of doctors, and the solution is quick. In 7 minutes, I got to give you pills to try to solve your problem because I don't have time to spend with you. When I was growing up, we knew our family doctor. They came to dinner. They belonged to our church, and it was a relationship. We just don't have that anymore. So we need to get to the point where we're encouraging people to get into medicine, to develop better doctors, and part of that is get them out of the business side of things. You know, hospital systems are now buying primary care doctors at an all-time rate, and the reason is because that's their sales force. It allows those primary care doctors to refer people upstairs to get more tests, more procedures done that are more expensive, and we've got to start getting away from that and separating those access to care, which is a primary care doctor, but increasing the access in that manner as well.
Wow. Mm-hmm.
Well, good points there, Seth. You really put it in perspective for us. We appreciate it. Seth's website, by the way, is gdpadvisors.com. You can find it on our website at radiocommonsense.com. Seth, thanks so much. Hey, have a good weekend. Sure glad you shared that with us. We look forward to having you back again in the future.
Hey, thanks for having me on. You guys have a great weekend.
All right,
you
take
too.
care.
Thanks.
Yeah, whole interesting area.